Hello everyone, so welcome back to my channel. And today we will see a very common disease that is very common amongst us, but sometimes it may lead to deleterious effects over the whole body. Especially it's a cardiac condition with an aged patient. So let us see mitral regurgitation really very fast and some of the indicators of how it can affect the body and some of the indicators that we can visualize directly on 2D echocardiography. So we have this female patient who presented to us with marked breathlessness, although she is okay now, but I just wanted to show you some of the glimpses of her echocardiographic features that reveal that she has a significant mitral regurgitation. So let us straight away jump to the echocardiographic features. So I will directly go to the 4-chamber view of this patient. Upon doing this echocardiographic features, I noticed that this patient has an interatrial septum which is deviated to the right, which signified that there might be something loading the left atrium and making it bigger. If you consider the left atrium and the right atrium, the left atrium is much bigger than the right atrium. Also, this is the interatrial septum which is getting deviated towards the right atrium, which is signifying that the volume and the pressure inside the left atrium has increased. Also, if you pay attention to the left ventricle, it appears markedly dilated in this case because the left ventricle has to accommodate the extra amount of blood with each heartbeat because it is a case of mitral regurgitation. Also, coming to the color Doppler features of this patient, when I put a color Doppler, I could easily see a significant jet of mitral regurgitation coming from the left ventricle inside the left atrium and nearly hitting and turning at the roof of the left atrium. These all things, along with the changes of dilated left atrium, deviated septum to the right, a big left atrium, were signaling that the patient has severe mitral regurgitation. Hence, it was causing all the back pressure changes and the patient was having breathlessness. Remember, this jet is after the patient is being treated. Earlier on, this jet was massive. So, let us directly go to a very common feature that we do these days to quantify this. I could have easily calculated the volume of regurgitation, but I thought I should not waste too much of time. So I straight away went and calculated the LA area. So after calculating the LA area, I calculated the jet area that is coming back into the LA. So the guideline says if the regurgitant area is more than 50% or nearly 40% of the LA area, it is a severe mitral regurgitation. So let us see what was the LA area. See, in the meantime, I calculated this LA area, which turned out to be around 14 centimeters square. What happened when I calculated the area of the jet that is coming inside the LA? This happened. The area of the jet is coming into the LA back is around 8 centimeters square. So clearly this area of the jet regurgitating inside the LA is more than 50% of the LA area, and hence this is a significant, or you can say a severe type of mitral regurgitation. I would again emphasize on one point that this picture is after the patient is being treated with all the drugs that would reduce the cardiac load. Then too, this is such type of a regurgitating jet. So our CVTS surgeon is in line and we are planning to subject her to various tests to see whether she is fit for any surgical interventions which we will do for the betterment of the patient. So this was in short regarding some of the points like enlarged LA, deviated septum, area of the jet in comparison to the LA area. All these things can help you the next time when you see such patients on 2D echo. Thank you so much for your kind attention.